If you take oral birth control pills or are thinking about starting them, you may want to listen to this, as there are some side effects of the birth control pill that your healthcare provider may not be telling you. So today, there are literally dozens of birth control pills available for use. Approximately 13% of women of reproductive age use the birth control pill. So first, let's talk about how the birth control pill works. First, it stops ovulation. Second, it makes it very difficult for the sperm to get to the egg. And third, it prevents the lining of the uterus from thickening. And all these things together make it really difficult to get pregnant. So let's start by talking about some of the advantages of the birth control pill. So first and foremost, it gave women the freedom to have sex without the worry of getting pregnant. Some other positives of the birth control pill are it can reduce some of the pain that some women feel during their periods. About 20% of women suffer from significant pain during their periods, and the birth control pill has been widely used to limit some of that pain. Additionally, it can reduce the risk of developing the risk of certain cancers, such as ovarian and uterine, for those who may be more susceptible to those cancers. Now, there are a few that many of us know and our healthcare providers have informed us of, such as blood clots. Especially if you're a smoker, blood clots are a risk. Blood clots can lead to strokes, which is obviously a bad thing. Some other negative side effects are nausea, headaches, breast tenderness, and for many women, I know from my friends and patients over the years have described to me, are mood swings. Some women say that the pill makes them feel absolutely crazy. Now, let's move on to some of the side effects that your healthcare provider may not be telling you. First is a decreased libido. It's great that the pill can prevent us from getting pregnant, but if we don't want to have sex in the first place, then what's the point? Second is it reduces our ability to self-lubricate. I can't tell you how many young women who are on the birth control pill say they need to use added lubrication during intercourse because they can't self-lubricate. Now, many of them think that there's something wrong with them, when in fact it's likely due to the side effects of the birth control pill. Another side effect your healthcare provider may not be telling you about is that it can reduce the size of your clitoris, or what you see of the clitoris, or the head or glands. Now you ask yourself, well, how big is my clitoris supposed to be? Well, if you look at the tip of a Q-tip or cotton swab, that's about the size of a normal clitoris, or at least the head of the clitoris. So the birth control pill can reduce the size and in some cases make it hypersensitive or painful to touch. Now, as we can imagine, that may make orgasm more difficult or painful. Lastly, another side effect of the birth control pill for some women is it can cause a condition called vestibulodynia. Now, literally, vestibulodynia means pain of the vestibule. And the vestibule is part of our vulva that is tissue that surrounds the opening of our vagina, surrounds the opening of our urethra, and the tissue around the clitoris. Now, if this tissue becomes hypersensitive or painful, it can make intercourse or any sort of vaginal penetration very painful, or even just to touch, it can be very painful. Why does the birth control cause some of these adverse effects in women? Again, it comes down to hormones. The birth control pill reduces our available estrogen and testosterone. And without getting into all the nitty-gritty, basically our vagina and vulva, we need estrogen and testosterone for it to be happy and healthy. So what are some alternatives if you don't want to use the birth control pill, or if you've been on the birth control pill and have had some of these side effects? Well, you could always use good old condoms. They work to prevent pregnancy and they work to prevent STIs. Another alternative is an IUD, or an intrauterine device. Now, this is a small device that is placed inside your uterus. It can be hormonal or non-hormonal. The hormonal option does not have the same negative side effects that the oral birth control pill does. So there's a couple other forms of contraception that are good alternatives to the birth control pill. One is an injectable, most commonly called Depo-Provera, and another is an implantable contraception. So if you've been on the birth control pill, let us know how you feel about it. Do you love it? Do you hate it? Have you experienced some of these symptoms that your healthcare provider didn't tell you about? We look forward to your comments. Thanks.